So you have ADHD, but you don't want to take a stimulant. What options are available to you? My name is Dr. Dunn. I'm a board-certified adult psychiatrist, and I get this question all the time from my patients, as well as from people on this app. Of course, there are a few non-stimulant alternatives as far as pharmacologic interventions. So one is something called atomexetine, or Strattera is the brand name. And so this is a selective norepinephrine reuptake inhibitor. So it increases the amount of norepinephrine available. And this is similar to stimulants, but it tends to be gentler, fewer side effects. At the same time, it's not quite as powerful. So some people don't find it to be effective. But for those for whom it works, it's a great option. There's also bupropion, otherwise known as Wellbutrin. This medication can also be used for smoking cessation, in addition to being an antidepressant, and to be used off-label for ADHD symptoms. So this medication can be a good option if someone has comorbid depression, if they have bipolar disorder, because it's safer in people with bipolar disorder, it's less likely to trigger mania, or in people who are trying to quit smoking. It also tends to decrease appetites. So if there's been a concern about weight gain, this can also be a good option. And then lastly, there are two alpha agonists. There's clonidine and guanfacine. These are actually blood pressure medications. So the risks are usually associated with that, like dizziness, things like that. They are not FDA approved for use in adults in the United States. We use them pretty routinely in the treatment of ADHD symptoms in children. However, there is a bit of a growing movement to prescribe these in adults for their ADHD symptoms, and it's even been approved in other countries like Japan. But let's say you don't want to take any prescribed medication. So there are a few supplements that can be helpful for ADHD symptoms. So things like omega-3 or fish oil can be really helpful, magnesium, as well as zinc. And I've talked about all these supplements in other videos, so check out my video if you want to hear more about them. There are also a few adaptogen supplements which can be helpful. So things like ginkgo biloba, rhodiola rosea, and ashwagandha. However, for some people, there are some risks associated with these supplements. We don't have a lot of rigorous trials looking at their efficacy and safety. And for some of them, there can be interactions with some of your other medications, either psychiatric or somatic. So if you're thinking about starting one of these, make sure to touch base with your prescriber to make sure that it's safe for you. Now, lifestyle factors are hugely important as well. And I think that this is something that's not emphasized enough and when we're talking about how to treat ADHD symptoms. So we'll talk about things like sleep, your diet, exercise, and elimination of toxins. Okay, so one, sleep is super important for any mental health condition, but especially for ADHD. We know that all the symptoms of ADHD, things like restlessness, inattention, brain fog, like these are all going to be worse if you're not sleeping. Then let's talk about diet. So this can be a big trigger for people with ADHD because there's kind of the impulsivity, the wanting to get that immediate gratification from things like ultra processed foods that taste really good, and they kind of get to that bliss point. You just want to keep eating them. But these are actually going to do the opposite of what is helpful for you. So basically, if you're having something that's a refined sugar or carbohydrate, you're going to get a really quick energy spike that's followed by a crash, which is going to cause worsening ADHD symptoms. What you want is something that's going to provide you sustained energy, so more like complex carbohydrates coming from whole food sources, so that you're not getting that quick spike and then crash. Additionally, these things are going to increase risk of things like inflammation, oxidative stress, and insulin resistance, all of which are going to negatively impact your brain's ability to function. Exercise can also be hugely beneficial, not just to get out that restless energy, but when you exercise, you get a release of endorphins. So we're talking about dopamine and norepinephrine, and these are the things you need in order to be able to think clearly and function at your best. So if you get some exercise in, you get an endorphin boost, it's kind of like a natural stimulant. And then lastly, we'll talk about elimination of toxins. Of course, there's environmental toxins, things like pesticides, heavy metals, air pollution. But when we're thinking about ADHD, I'm especially concerned about substance use. So things like cigarettes, alcohol, other illicit drugs, because we know that there's an increased chance of misuse and substance use disorders in those who have ADHD. And it's often in an attempt to self-medicate their symptoms. But at the same time, just like with ultra-processed foods, it's counterproductive because it's negatively impacting your neurotransmitters, the cell signaling, and of course the urge to use more and to get that quick fix is likely to have negative consequences for you. So abstinence from substances is the best way to go with ADHD. So if you're not interested in stimulants or other pharmacologic interventions, then definitely give these lifestyle changes a try. They're low risk and they can really be high yield. If you've used any other non-stimulant interventions for your ADHD and it's been really helpful for you, please share in the comments below. I'd love to hear about it. I'm sure that my viewers would love to hear about it too. Wishing you all good mental health today, and I'll see you in the next one.